So sex is what, when I'm using more medical terms, it's more physiologic. So when you're looking at like genetics, hormone signals are what determine it in so much as it's kind of a growth plate for the body. The humans by nature are programmed to grow in a female pattern. So we all start off with the reproductive organs inside, and then we get a certain set of hormone signals that change the positions of pieces as we grow, like in utero, which is a fancy way of saying kind of in the womb. And so sex is the manifestation of that pattern. But one is determined by genetics, but there are times where if you interfere with like hormone signals, you can actually change that. There's really one signal that actually determines which growth pattern you start down in the womb. And so normally you'd say, hey, just genetics, but it's not, because there are situations where that changes for a lot of different reasons. And that's just with birth. Nowadays you can get it physically changed with the appropriate medical interventions. But I'm trying to remember the genetic term for it, and it's high school science, so I should, but it's basically just an outward manifestation.